Well, good morning. Can you hear me? It's a particular honor to be here in Dublin today. I was actually raised in 16 miles away in Newbridge, in County Kildare. And there are three things you need to know about Newbridge. Firstly, that it's raining. Secondly, that it was just raining. And thirdly, that it might just rain. And so when I was invited to come and speak here, I decided to pack the weather from Australia. You are welcome. Ireland gave me three wonderful things. It gave me a fantastic education. It gave me one of her daughters. And it gave me what in many other parts of the world they consider a funny accent for a little brown man. What happened at Trinity is in 1987 when I qualified, 70 of us were sent abroad because there were no jobs at home. And I think on our 30th reunion in October, about half the class have got professorial jobs in leading positions right across the world. So we did all right. I want to introduce you now to Joe. This is Joe. Joe is the biggest threat to the Australian and any other economy. He's currently 45. He's 78 kilograms in weight, 170 centimeters. So Joe has a BMI of 27. He's technically overweight. Joe walks from Parliament Station to a job in the city. That's roughly a 20-minute walk there and back. He considers himself to be active. He does no other exercise. To stay the way he is, Joe needs to consume 1,900 calories per day. To stay overweight, he needs to consume 1,900 calories a day. Now, this is what Joe eats. He has 5 Weetabix in the morning. You call them Weetabix, we call them Weet-Bix in Australia. He then has a panini breakfast, a panini lunch, and then his wife makes him meatballs and spaghetti in the evening with a glass of Australia's finest, South Australia's finest glass of red wine. Now that's 1,900 calories for Joe to stay exactly as he is. But in fact, what Joe doesn't tell anyone is that at about 10:30, just like you will today, he goes off and he has a tiny wee flat white coffee and a little blueberry muffin. Not a big one, a little blueberry muffin. And then at 2:00 in the afternoon, he's feeling very holy and he says, "Oh, look, I've been really good today, so I'll just have a banana for a break." And then at 8:00 at night, he will have 2 Tim Tams. Now, this is an Australian treat. These are tiny little chocolate biscuits. They're called Tim Tams. They do you no harm. Except that if Joe continues on with this, he will gain 1 pound a week. And by the time we get to 6 months, he will go from overweight to obese. And that's the reality. And it's the reality for all of us. So now I want to talk about Joe's doctor. I happen to be Joe's doctor. And this is the situation in Australia. 120 million consultations with GPs in Australia every year. Australians are getting older, they're getting sicker, and they're getting fatter. The demand continues to increase. So the average Australian will see a GP 5 times in a year. It's about the same as everywhere else in the world. So the white circle is everybody, and the pink circle in the middle are the number of people who have symptoms at any one point in time. So you're probably all sitting there after your coffee this morning and you've got a thumping headache. And you've been trying to peer at these slides, so you count among the 80%. The black arc are the number of people who will actually go and see a GP. and the other ARCs are all people who will be referred to hospital. The vast majority of healthcare is delivered in general practice. So when you talk to policymakers, this is what they think happens. So along comes Joe, and you see that he's overweight, and you give him some advice, and off he goes on his bike, and all is good. We can all now go home. The problem's been solved. Sure, Joe's only going to see us 5 times a year. Surely at some point you're going to tell him he's overweight and give him the necessary advice. The reality is more like this. So he'll come along and he'll say, I've got this terrible tummy pain. And so you're going to put him on the couch and you're going to examine him and you're going to do whatever you need to do. You have 15 minutes to deal with Joe on this occasion. And as he's getting off the couch, he'll say, and what about my knee? And you go, well, you've got 2 of them. He says, no, this one here is really hurting. So you then deal with his knee. And then in the last couple of minutes, you notice that Joe is overweight. He's getting a bit chunky around the middle. What are you going to do about it? Bearing in mind that obesity is not considered a medical condition in a country like Australia, if Joe had come in and said, I'm getting a bit chunky, can I have some advice? You cannot bill that to Medicare. You cannot bill that to the government. We know so little about the Joes of this world. We don't know that he's bored, mindless in that job in the bank in the middle of the city. We don't know about his debts. We don't know about his partner. We don't know very much about Joe. And this is the reality of general practice in my country. I want to talk to you now about 4 bits of science. And the first is this: anyone who's dealing with the issue of healthcare innovation or trying to solve people's problems needs to read this book. It's called Scarcity, and it's written by authors from Harvard and Princeton University. And what they say is that when you are stressed, no matter how well educated you are, your bandwidth is reduced very considerably, and you enter into a spiral of bad choices. Hence the blueberry muffin. The second thing is that we can measure motivation on the Prochaska scale. This is the Prochaska scale, and it ranges from pre-contemplation, contemplation, right through to maintenance. And you can work out with somebody sitting in there in your consult where the person is on the Prochaska scale. And those who are pre-contemplation, those who don't even know they have a problem, are unlikely to engage or unlikely to be motivated to change their behavior. Motivation is an extraordinarily difficult thing to achieve. Now, this is the work of B.J. Fogg. He's a Stanford professor of psychology. And he says that whether you are triggered, and I'll come to what that means in a moment, whether you are triggered to change your behavior depends on a trade-off between motivation and ability. So there on the top left-hand side, you've got somebody who's very motivated, but they aren't able to do what you're asking them to do, so they become frustrated. The chap at the bottom, he's neither motivated nor able. We won't go there. The girl on the right, is typical of the problem we have in Australia. We are the melanoma capital of the world. And everybody knows that when you go out into the sun, you wear sunscreen. It's not a hard thing to do. But you walk around a beach around Christmas time. The reason we went to Australia, by the way, is because we have a friend, an Irish friend in Australia, who used to send us pictures of kangaroos on the beach as Christmas cards. Kangaroos surfing on the beach, and we thought, we need a bit of that. Anyway, you will find these young people lying there on the beach in the sun with virtually nothing on, and you cannot change their behavior. The top right-hand side is the menu that nature has given us to deal with our problems. When a child cries, what do? You pick the child up. Motivation, ability, trigger. The trigger are the cries of the child. The other thing we need to talk about is the teachable moment. This is what is a teachable moment. And essentially, pregnancy is a teachable moment. When you're pregnant, you see yourself as a family. You see that the risk is very high if you continue smoking. And therefore, it is much easier in a teachable moment to change someone's behavior and achieve smoking cessation. I want to talk now about a couple of triggers that we have used in clinical trials. And this one is for obesity. This is what obesity looks like in Australia. It just continues. There is no stop to the exponential rise to the waistline. From 1980, when I went to medical school, to date, there has been no rise despite everything that's being done about it. $60 billion a year it costs us, in direct and indirect costs, to manage obesity in Australia. So what we were looking for was a trigger to trigger weight loss. And this is it. It's called Future Me. It's an app. You take a photograph of your face. It then shows you what you look like now on an avatar. And then you can dial the avatar and you can see what you would look like in the future if you just change things. And it tells you the cost. So here it's telling you that you'd have to consume 1,600 calories per day and exercise 30 minutes a day for 5 days a week to go from that to that. And so what you talk about there is simply, how am I going to achieve it? So we showed people these avatars and asked them to choose how they would like to look. And there's the results of our trial. The majority of our participants were highly motivated, and they were all obese. In 6 months, 1 in 5 of them had lost more than 5% of their body weight, and men were just as likely as women. Bearing in mind, they were given no dietary advice, no advice on how to do this. They were simply shown the pictures and sent to go and solve the problem, and they did. This is the other one. This is for smoking cessation. Now, we know that young girls are taking up smoking more than anyone else in any other demographic. And you know the reasons for this. Can anyone guess? Weight loss. They want to look good. So how about we show them what it's going to do to them if they carry on smoking? And this is the software. It's called April Age. And you can see there Lisa's pictures as a smoker and a non-smoker. So she was shown these pictures and given 2 minutes of smoking cessation advice. And we did this in another randomized controlled trial, mainly females, 24 years of age on average, and all light smokers, at least. We screened a lot of people, and you need to be aware of this. The problem with technology is that it is not indicated in every case. It is extremely difficult to get a piece of technology that works for everyone all of the time. Screened 1,250, and eventually 59 got the intervention. And you can see here that 1 in 7 quit smoking. Men were just as likely as females, and was highly economically advantageous to use this as an intervention. So we're nearly at the end. And what we know is that 65% of Australians, and I would think the figures are similar here, have a smartphone. This is an ideal place to put triggers. Triggers, remember, BJ Fogg's were triggers to reduce weight, increase exercise, stop smoking, deal with back pain. We've got some interventions in that space, and deal with our increasing alcohol problem here and everywhere else in the world. If you'd like to hear more about these sort of things, I am the editor of the Journal of Health Design, and we'd be delighted if you would take a look. Thank you.